let's review the embryology, the classification, the imaging modalities, and the treatment options that we have for the various Mullerian duct anomalies. Starting from the embryology, as we all know that the female reproductive system is composed upon the uterus, the cervix, the vagina, and the ovaries. The ovaries are derived from the germ cells. The lower one-third of the vagina is derived from the sino-vaginal bulb. But the rest of all the structure of the female reproductive system is formed by the two Mullerian ducts. You can see here, these are the Mullerian ducts. These two Mullerian ducts would unite to form the structures of the uterus, cervix, and the upper two-thirds of the vagina. Now, Mullerian development occurs in three phases. We have categorized them into three phases, which include organogenesis, fusion, and septal resorption. These purple lines are the Mullerian ducts here. You can see Mullerian are the Mullerian ducts. This is called the Mullerian duct formation. And the next step is that the two Mullerian ducts would fuse together. This is the duct fusion. And next would be the septal resorption, resulting into the functioning reproductive system. Okay. Now, if Mullerian duct anomaly result, the defect might be at any of the three phases of the Mullerian duct development. If the defect is at the level of organogenesis, that is, the Mullerian ducts do not form at all, that means that the uterus would not be there. So this is called agenesis or hypoplasia of the uterus, and definitely the patient would not be having the uterus, so no reproductive potential. A very famous example of that is MRK syndrome. But even in that, as the ovaries are intact, the patient would be having secondary sexual characteristics. However, the uterus would be absent. In that case, surrogacy is possible. The next effect would be at the level of fusion. If the fusion does not occur, then you can see it here. If the fusion does not occur, then the two Mullerian ducts would result into uterus diadelphys. You can see there are two uterine cavities, two cervix, and two hemivagina, as the fusion has not occurred at all. And if the fusion is partial, then it might fuse together at some point, and that is referred to as the biconjugate uterus. The next one is the septate uterus.